Hi, my name is Dr. Brian Wright from Walnut Creek Animal Hospital in Purcell, Oklahoma. Today I want to just take a little bit of time and demonstrate how to do a field tailgate exam on a working canine. So this applies to hunters, trackers, law enforcement, bite dogs, you name it. We can gain a lot of information by assessing what's normal. Today our subject's going to be Forrest. And so what I start out with in an exam is I first just want to monitor the overall appearance. Generally, how did he come to me? Was he limping? Carrying a leg? Is their head carriage different? Is his mentation normal? Bright and alert he should be, not depressed looking, not grimacing, anything like that. Ears were equally symmetrical, so we're gaining a lot of information about him immediately just by observing. One of the main things we want to look for is what his respiration is like, and it seems to be fairly normal in that it's slow. He doesn't seem labored. He is panting a little bit, but that's normal as well. So the first thing I usually do next is let my hands do the seeing, so to speak, and so I just palpate and make sure everything up here feels normal. So we'll start and look at his eyes, and what we want in his eyes is both of his pupils to be equal and symmetrical, and then open his eyes to make sure there's nothing, no foreign bodies in there, and the corneas are clear. The next thing we'll move to is the tip of his nose, and so what we're looking for with his nose is to be wet or moist, a little bit of serous, clear discharge, no mucus, that sort of thing. The next thing we'll do is do an oral exam, and so the easiest way is just to press your thumb inside the top of his mouth, and most dogs open up for you. And so we're just going to look at the teeth, try to get a quick look, make sure there's no broken teeth or there's no lacerations on the tongue or anything like that. So the next thing I want to do is do a capillary refill time, and so this is an assessment of cardiovascular function. And so the way we do this is we roll the lip up and we look at his mucous membranes and we press and we let our finger off and we see how fast that mucous membrane has returned to pink. And so pink's normal, and then once you press your thumb on there for 1 or 2 or 3 seconds and you let off, it pushes all the blood out of that area and turns it white. Well, it should return to normal within 2 seconds, and so we'll demonstrate that one more time. And that is normal. So the next thing on palpation, I just generally work my way down the dog's body, make sure everything is equal and symmetrical. The dog has 2 halves. Both sides should be the same. And so lumbar spine, we'll slide him around so you can see his back, both sides, come down both hips, palpate both legs. We want to look at the feet, make sure there's no lacerations on toe pads, torn nails, that sort of thing. I always put these dogs through a full range of motion in all 4 limbs. They're going to let you know if there's something wrong when you do this. His seems to be pretty normal. The next thing is we want to palpate the abdomen. So I put my offhand away and we just press slowly and easily into that abdomen. And what we're looking for is any sort of pain response, so him to push against me, or for there to be a large mass or something like that, something fairly obvious. So once we get to that point now, the next thing we want to try to do is assess some of his vitals. So we want to first just count how many respirations he's having in 6 seconds or 15 seconds. If you do it in 6 seconds, you're going to multiply your number by 10. If you're going to do it in 15 seconds, you're obviously going to multiply it by 4. And that's going to give you per breaths per 1 minute. And so when they're panting, it's obviously a little bit more difficult, to assess, and panting is normal as well. So the next thing is we want to assess a heart rate. And so there's 2 places that are easy to get a heart rate on a dog. One is right behind the right caudal to the elbow, and it's where the cardiac silhouette is. And so you can either grab across the chest, and so you can feel the heart bound on both sides, your thumb and your forefingers. The other area is on the inside of the back leg, and so the femoral artery basically travels down the inside of the back leg, and so you can take a flat hand and press outward on the inside of the back leg, and his femoral artery is about the size of a pencil, and you can assess every beat that his heart makes. You want to check both sides. Both sides should be equal in number at the same time, and so you can do that from behind. Generally, resting heart rate on a very fit dog is going to be in the 70, 80 up to 120 range, 130, depending on their physical abilities. Anything that gets over 150 or so, unless they've been just put through extreme work or something like that. So that brings up another point. We want to assess this dog's normal at two different phases of time. One is resting, and we want to record that information for your particular dog because it's going to be a little bit different for everybody. But we've listed vitals for you guys on what should be normal, and that's just the average dog. Figure out what's normal for your dog. Spend some time doing this. So what you want to look for is doing it at two different times. One, after work, so we've just tracked something, or we've been playing ball or something in the yard. We've done bite work. Either way, we want to take some time before we put that dog in the kennel, and we want to go through their vitals. What's normal for them at that point? But also when they get up in the morning or when they're at rest. They just come out of the carrier, and so that makes up the entire norm for them. The last thing we want to do, of course, is a rectal brief exam and thermometer for a temperature, and so it's just inserted. Takes just a second. Once it stops, then you're done. Record the temperature. Normal temperature on the dog typically is something over 99, and should be less than 102.5. This will be a little more elevated as well, especially if a dog's been working. So anything at work, we want definitely less than 104 if you're going to assess them then. So that kind of concludes the end of this portion of this video series. Hopefully it was a benefit for you, and I hope you'll take it as a challenge to learn what's normal for your dog. Thank you.